If you're on Medicare Advantage, there's a real chance your plan won't exist by January, and you might not find out until a letter shows up in the mail this fall. According to recent reporting, insurer Humana alone expects plan exits to affect approximately 600,000 members going into 2027, with other major insurers expected to follow. That's one of 4 updates hitting Medicare and Social Security right now, and I'm going to walk through all 4, starting with the one that has the tightest deadline attached to it. Major insurers are exiting Medicare Advantage markets. Let's start with the plan exit issue, because this is the one requiring action from you personally, if it applies. According to Forbes reporting from early August, Humana executives confirmed during their most recent earnings call that they will have what they called targeted plan exits for the 2027 benefit year, on top of similar exits they made in 2025. Other major insurers haven't confirmed exits yet, but according to industry reporting, they're expected to follow given rising medical costs across the industry. Here's why this is happening. Every summer, health insurers submit bids to the federal government estimating what it will cost them to cover Medicare Advantage members for the coming year. When those numbers don't work in certain markets, often rural or lower density areas where profitability is thinner, insurers pull out of that specific market entirely rather than keep offering an unprofitable plan. If your plan is exiting, according to Medicare rules, you'll qualify for a special enrollment period and must select new coverage before your current plan ends. The critical detail is that a non-renewal notice can look exactly like routine insurance mail, easy to set aside without reading closely. When notices go out this fall, opening every piece of mail from your insurer isn't optional this year. A higher drug cost cap is coming in 2027, now for a piece of genuinely good news. According to CMS's finalized 2027 policies, the annual out-of-pocket cap for Medicare Part D prescription drug costs is rising to $2,400 for 2027, up from $2,100 this year. Once you hit that cap, your covered prescription drugs become free for the rest of the calendar year. This is part of what's being called the permanent Part D redesign, a simpler, more predictable structure than the older system, where costs could keep climbing throughout the year with less of a firm ceiling. According to CMS, this final rule also includes updated plan quality ratings and revised marketing rules for how insurers can advertise Medicare Advantage plans to you. Real quick, if you haven't already, hit subscribe now so you don't miss next week's update, then let's keep going. The one thing worth remembering here, a higher cap is good news for people with expensive prescriptions, but it only helps once you actually reach it. If your annual drug costs are well under $200 already, this particular change won't affect your bill much either way. Medicare Advantage extra benefits are getting cut. Here's a trend that's been building over the past couple of years and is accelerating for 2027. According to Newsweek's reporting, millions of Medicare Advantage enrollees have already seen popular supplemental benefits scaled back. Things like over-the-counter allowances, meal delivery benefits, transportation assistance, and fitness program access. According to finance expert Michael Ryan, quoted in that reporting, insurers added these extras, OTC cards, grocery allowances, rideshare benefits, during years when federal payments to insurers were more generous, specifically to attract new enrollees. Now that CMS's 2027 payment rate increase came in around 48%, which insurers say doesn't keep pace with rising medical costs, many are pulling back on those supplemental perks rather than raising premiums directly car benefits, meaning dental, vision, and hearing coverage generally remain widely available and aren't part of this particular trend. It's specifically the extra perks, the ones that aren't required by Medicare but were added competitively, that are most likely to shrink or disappear from your plan for 2027. Social Security reversed its paper check elimination plan. Here's a policy update that reverses something we may have mentioned as upcoming in past discussions. The Social Security Administration had originally planned to eliminate all paper checks by September 30th, moving every beneficiary to electronic payment methods. According to CBS News reporting, the agency has now reversed that timeline and says it will continue issuing paper checks as needed. This matters specifically for beneficiaries who don't have a bank account, don't have reliable access to online banking, or have specific circumstances where electronic payment isn't practical. If you were told your paper check was going away by the end of September and you had no alternative in place, this reversal means you don't need to rush into a banking change you weren't ready for. That said, electronic payment remains faster and more secure when it works for your situation, so this reversal is about removing a hard deadline, not discouraging direct deposit as an option, closing together. So here's the full picture. If you're on Medicare Advantage, watch your mail carefully this fall for a non-renewal notice. If your insurer is exiting your market, you'll have a special enrollment period, but only if you catch the notice and act. The good news is your Part D out-of-pocket cap is rising to $2,400 in 2027, which helps if you have high prescription costs. At the same time, expect some of your plan's extra perks, OTC cards, meal benefits, transportation, to shrink as insurers adjust to tighter payment increases. And if you were worried about losing paper checks by September, that deadline has been reversed. SSA will keep issuing them as needed. The common thread across all four of these is the same every year. Medicare Advantage plans change annually, and the annual enrollment period, running October 15th through December 7th this year, is your window to actually review your annual notice of change and switch if your current plan no longer fits. If this kind of roundup helps you stay ahead of these changes, hit subscribe, because I break down real Social Security and Medicare news every single week. Official facts, no scare tactics, no guessing. And let me know in the comments, has your Medicare Advantage plan ever been discontinued on you before? I'll see you in the next one.